Hello, everybody, and welcome. Thanks for joining us again. I'm Stephen Wood from Deep Blue MedEd. I'm joined by a long-term friend and colleague, Jonathan Lemaire, who is joining us from Colorado. Is that correct? You're in Colorado now?
Yeah,
Although
yep.
usually you're in Haiti
Correct.
or, yeah, or other parts of the world. And we're going to talk today a little bit about kind of what's going on with COVID-19 in Haiti and developing countries, and kind of your thoughts and your observations of what's going on there. A lot of people have been talking here in the U.S. that it seems like we're responding to this COVID-19 crisis like a third world country. We're scrounging up, PPE. We're making beds in tents. We're doing all sorts of things that we don't really think about being kind of the structured healthcare system that we're used to in the U.S. And a lot of that's true. There's some shortages of PPE. We do have tents set up that are housing patients. We're obviously doing things differently than we're used to here in the United States from a healthcare perspective. But I don't think we're at the level of being in a developing country. Having done a little time with you there in Haiti, you obviously have a lot more experience than I do in that area. And so we've been kind of chatting on and off about this crisis, and I thought it'd be interesting for our audience to get an idea of what it's like in some of these developing countries that are responding to this crisis, and what some of your thoughts and views are on all of this. Just to give you a little bit of background, Jonathan and I worked together. We did a lot of telemedicine for one of the organizations he had been working with, and I remember thinking there were a few people that were getting MRSA. I don't know if you remember when you guys put in that new fake grass field, and there was like epidemic of MRSA, and how we were responding to that, and we had daily conferences, and like how that just seems so trivial now, considering what's happening here. So Jonathan, just tell us a little bit about what you're doing these days, who you are, and then we'll just kind of chit chat about the response, and how some developing countries, in particular Haiti, is responding to this crisis.
Yeah. Okay. Sure. Well, so I mean, I'm not a medical practitioner. I'm not a clinician. I am a social worker. Got my master's degree from Tulane University, and promptly moved to the developing world. First place I landed was Haiti, and I've lived and worked there full time for about 8 years, going on 8 years. And I've worked for mainly two different organizations. In nonprofit, and as serving as the director of nonprofit organizations. One that did run a medical clinic, which is how you and I first came to know one another, and ran a residential care program for children, vulnerable children and orphans, and now I've moved on, and I'm working in education, scholarships, and educational opportunities for girls and women living in rural poverty. So I am now in a very remote area in northern Haiti, about 4 hours north of the capital, and in a place where to get to the homes of the people that we work with and serve, you take a moto taxi for an hour, then you get off and you walk, and then you take a donkey up the mountain, and so it's a pretty remote place to go, and it's been a very interesting experience, having been the first 4 or 5 years in Haiti, but closer to the capital, which was affected so largely by the earthquake, to now be in an area that was not necessarily affected by the earthquake in terms of the damage and things like that. So, but along the way, of course, being a social worker and having the heart just to kind of do as much as I can, and noticing that Haiti has a very, I wouldn't even say broken system, I would say a non-existent system in terms of medical care, especially for the poor, which is most of the country. I would come across, or people would come to me as the only foreigner living in that town, and with the presumption that I have either resources or connections. And so over the years that I've been there, I've been able to kind of make, broker services, so to speak, as a social worker, and deliver services or bring people to services that they otherwise wouldn't necessarily be able to connect with or get into or access. So So yeah, I mean, it's challenging. Again, with a non-existent system, especially with COVID right now. There was just a report that came out that the entire country of Haiti, which is about 11 million people, um, around 3 million are in the capital, and the rest are living in these rural areas outside of the capital. It's just so most of the country is living in hard-to-reach places. Um, there are something like maybe 150 ICU beds for the whole country, and there are something like 60 ventilators in the whole country. And I would guess, I mean, I don't know this, but I would guess most of those are located in the capital. It's some of the better medical facilities that exist. So when COVID comes on, or when anything comes on, and you're in a rural area, Haitians historically have been sort of led astray, to put it nicely, and so there's a lot of mistrust and of foreign interventions and foreign interference. As a people, they have not necessarily been treated very well by the international community from the revolution forward, really. So the biggest challenge is that I've seen, and of course, I had left Haiti to go on a project in Malawi, excuse me, back in January, and this COVID thing sort of erupted while I was in Malawi. So I was watching from afar and speaking to my staff as to what's happening, and largely the most common response that I've been hearing from people, from my friends, my Haitian friends, is that this is not true. This is either a ploy by the Haitian government to get some international money, because there's this whole political thing happening right now where the government of Haiti has been basically accused of stealing lots of billions of dollars that came from Venezuela by way of a deal for gasoline, petro kind of thing. So there's this huge amount of mistrust with the government. So there's the element of people that say, oh, this is just made up so the government can tap into some more resources and steal it from the people. So there's that element. Then you have the element of, culturally, there's the practice of voodoo and sort of attributing things to the magical and mystical world, supernatural kind of thing. So you have this sort of perfect storm of all these different circumstances where people mostly aren't believing what the warnings are, and so they're not heeding any of the the calls for social distancing, things like that. So
Yeah.
So it's really complicated. I mean, as everything in Haiti is, there are a lot of layers to addressing this kind of a thing.
Well, for one, you're selling yourself short on not being a medical practitioner, because I know that you have a pretty good expertise in a lot of different aspects of taking care of people from a medical standpoint. I at one time kidded that we should give you an honorary medical degree for all that you've had to deal with. But we also here in the United States have someone who's had some mystical thinking in around this pandemic, and from I remember actually hearing this particular person say that by Easter, which I think is in a few days, or even tomorrow possibly. Yeah.
Yeah.
I'm sorry. I'm half Jew, half agnostic, half whatever. So yeah, tomorrow, that we'd all be out celebrating. And that doesn't seem like that's going to come to fruition. So I feel for you in that regard. I also, where I work here in Boston, we have a large Haitian population, which is honestly part of why I decided to work where I do. I enjoy working, with that group of people. And unfortunately, we've seen the impact of this disease has really hit this patient population very hard. And part of me, one of the reasons I wanted to have this discussion was to, most of them are coming in and they're already quite ill, to the point where I'm sure it's been days where they've been sick and days where they've been deteriorating. And you have to have, it raises some concern as to why are people waiting so long to come into the hospital. I think, it's multifaceted. It's a systemic problem that, people just have a mistrust of the medical system, that, there's some cultural aspects to this as well, that we, that carry over from when they've left Haiti to here. But, it's devastating really what the impact of this virus has had on our population here. I can't imagine what it's going to be, like there in Haiti, where, as you mentioned, social distancing just isn't feasible. It's just
Yeah, it's
not
not an
something
option.
that people can do.
Yeah,
And access to care is also incredibly limited. And you mentioned 150 ICU beds. My small urban emergency department will have 150 ICU beds alone. And that's
yeah,
just one of the hospitals in Boston that will have them. The other piece of it is I remember when I did come over there and visited and was working with you, one of the things that I was working in the clinic and people were coming up and their complaints were, oh, every night I get really hot, I have body aches, I just feel, ill all over, I don't feel well. And I kept thinking, oh, this is malaria, and actually it's hot in Haiti. Everyone's working all day and that's why their muscles are sore. And these are the exact same symptoms that we're seeing with COVID-19. So just, you're going to have
yeah,
all these people with these symptoms that could or might not be, and just, yeah, there's just nothing set up in I think there, especially to manage what are you going to do? How are you going to, you know, how do you flatten a curve in a country that there isn't going to be any testing, you can't social distance,
right.
there isn't any healthcare to begin with, so it's really stressful to think about, how is this going to impact countries like Haiti and others?
Yeah, where I live and work in northern Haiti, a town is called Guilmorne. For those who know, it's just about an hour north of the town of Gonaive. Um, it's a real rural area, and you have a lot of farming and a lot of agriculture, and the women mostly are the marchands, the women who sell their wares, and they typically travel. They pile into the back of these trucks and buses and whatnot, and they travel from town to town for their open market day. Each town usually has 1 or 2 days of the week where they have their big open market. And the government, of course, has stated, only Saturday for this town and only Tuesday for this town. And, that's all fine and well, but they have no ability to enforce, no capacity to enforce any of that, any of those directives, really. Um, and so what happens is you have large groups of women who are gathering to make a living, to sell whatever they can sell to get by just for the day, um, and then they're going back home where they're living you know in community, really, very collectivist sort of society where you have 6, 7, 8, 10 people to a one room kind of place. When you're talking about the rural poverty, the rural poor in Haiti. So social distancing, it's funny, I was talking to one of my employees this morning actually, and I said to him, what's going on and what's the general sense about, and he kind of laughed and he says, oh yeah, Corona. He said, they tell us not to go outside, and they tell us not to be in groups. He said, so we have a choice. We could sit at home and starve to death, or we could go out and go to the market and maybe get Corona, but we have to, we don't really have any good options.
Yeah.
And the Ministry of Health in Haiti, MSPP, this morning, on Facebook, which I find, I could get into lots of different complaints that I have, but the government of Haiti, they like to use Facebook for their public communications, which is great for the percentage of people that have internet access and laptops and computer in Haiti.
Right.
Never mind electricity. It's kind of like calling everybody to homeschool in the States, and you've got people who are poor and don't have internet and laptops, and what
Right.
those kids do. But
Right.
they put out on Facebook today that 31 confirmed cases of COVID-19 in Haiti to date, with 2 deaths and 1 fully recovered. I don't know where the other 27 are.
Right.
And then they did say there are about 300 quarantined. And I don't really know what quarantine would look like in Haiti, but I do know, if you compare those numbers to what the Dominican Republic is reporting, it's just, thousands. I don't even know the numbers in the DR, but it's a far cry. So there's no testing. There's a general skepticism that it's even existing. You have the cultural, beliefs that come into this, where often medical issues are perceived as either a punishment or something evil being done to you by somebody else who maybe has a problem with you. And the belief that if your problem isn't medical in nature and you try to seek medical care to fix that problem, then that could be worse for you than if the problem is actually spiritual or related somehow to, supernatural or other issues, mystique, they call it, or magic. So if the problem is believed to have been caused by something non-medical, then medical treatment is actually going to kill you.
Right.
I think you know a lot of the same people I know in Haiti, and one of my best friends and drivers from my first job. I won't say his name, but you might remember he had a horrible case of athlete's foot on one foot.
Yeah.
And because he was the driver, he believed that somebody poisoned the brake pedal in the car.
Right.
So that because they wanted his job, they were jealous of him having the money to have a house and take care of his family, and so they wanted to take his position. And you and I can look at that and clearly see this is athlete's foot. That's a fungal infection, and you need to treat it with X, Y, and Z. And to get him to treat it medically, with medication, was a chore because he believed, no, I'm going to lose my foot, and he was literally on crutches, could barely walk before I finally said to him, look, here's the money, go to your voodoo priest, because I know that's what you're going to need to do, but take this fluconazole or whatever it was it's probably not the right medicine, but whatever it was to treat it. And he did, and I was like the miracle worker, like, oh my God, my boss, I'm so much better. And it's amazing what a Tylenol will do to a population that has absolutely no access to medical care.
Right. Yeah, sure.
And so it's, you talked about like the body aches and sort of the non-specific complaints that people have. You're carrying 5 gallons of water on your head 3 times a day up a mountain. It's going to hurt. Your neck is going to definitely hurt. It's hard enough to address medical issues when you can actually see them and touch them and feel them and diagnose them. And the person that you referred to earlier, who thought that by Easter we'd all be fine and well, not unlike his description of this sort of invisible beast, this silent killer. It's even harder to get people to believe things they can't see, right? So you can't point to it and say this is where you're sick or this is why you're sick. So there's just so many layers on it, and I'm very fearful that my American and Canadian friends in Haiti, a lot of them have left, but there are a lot that are still there. Quite a few people are still there. They're just saying it's a ticking time bomb, and they're just waiting for it to get bad. And I'm really fearful. I saw one estimate that, and again, I don't know if this was it came out, it was a physician from the Ministry of Health in Haiti who said upwards of 800,000 people could die from this. Sure. Again, that could be alarmism, but even to state that publicly, as a government official, is pretty dire. But and then you have this, again, you have all these different pieces kind of coming into play, where I just think it's a perfect recipe for total disaster in terms of the fallout for this. But it is moving slowly, it seems like. Again, that's probably also being undertested. But it's challenging to get people to take your word. I always think back to this one example where, if there's a hurricane that's coming, right, and we can get online and and look at the satellite imagery, and we can see the cone of prediction and that kind of stuff. And so I'll say to my staff, hey, looks like we might have a hurricane in the next couple of days. And they all laugh at me like I'm crazy. And they say, oh, the first response is, well, God wouldn't let that happen to Haiti. So the role of faith is certainly a big play. And, who can go up against that, right. Especially a foreigner. And so you say, okay, well, that's fine, but we're still going to prepare because I'm in charge of this organization. And we've got 200 high school students in our care, and, I'm responsible for. And, so X, Y, Z, and you take all the precautions. And then sure enough, last minute, the hurricane moves and it doesn't hit. And then ability goes right out the window.
Right.
And so it just kind of, any kind of warning that doesn't come to be, just sort of erodes the confidence,
right.
or the value, or so it just it's just a long, complicated Gordian knot of circumstances. I think that
yeah, sure,
it could really be a pretty dire situation there.
And then I think you couple that with it's a very transient system for medical care. What we've called voluntourism before, and it's not a term we invented, but where groups come down a week, 2 weeks at a time. So it's a very transient, system for medical care. I can't even imagine if we have PPE shortages. I'm guessing that there's nothing in Haiti,
Yeah.
at all, to protect people. And then as you mentioned, just the resources are just so low. Yeah, this is set up that if this were to spread through that nation, I think the numbers would be devastating. And I think,
Yeah.
yeah, I think unfortunately too, what will happen is that the only thing that will, it's so isolated, and I don't think people are going to be coming in the numbers that they've had in the past. This isn't the earthquake. This is a
Right.
disease that's around the world. No one's going to come from the U.S. or Italy or France because they're dealing with it on their own soil.
Right.
Haiti's going to be left alone, with this issue.
Yeah, well, and that's a good point you bring up too. And the earthquake, of course, brought massive international attention and foreign presence, and some of it was good help, some of it was not, as we know. But a lot of those organizations that came in after the earthquake, because they were coming under disaster relief or disaster emergency response kind of thing, they came on like 3-year contracts, 5-year contracts. And now we're 10 years after the earthquake, so we're seeing the Doctors Without Borders, Médecins Sans Frontières, they're leaving. They're packing up. They've all packed up and left. Some of these big foreign NGOs that brought resources and options for care, they're gone. They haven't. They didn't come for full time. They came. They didn't come to be permanent. And we've seen MSF, have to close down because of, never mind. We haven't even talked about the security situation in Haiti right now, where there is just all but anarchy in certain parts of the country, especially some of the rougher areas around Port-au-Prince. There's a lot of gang warfare happening. There are, just a few last month or February, I think there was the newly formed or newly established Haitian army was engaged in open firefight in the middle of Port-au-Prince with the Haitian police and shooting at each other, and it's really fragile anyway. So to add this on top of that, it's just, and there was just last month, there was one of the doctors at the Bernard Mebs Hospital, which is part of University of Miami's healthcare system. It's considered probably one of the best, second probably best hospital in Port-au-Prince. Well, the best in Port-au-Prince, but anyway, they kidnapped this doctor, the gangs, because one of their guys had been shot and they needed him to be, to treat him, and they knew if they went to the hospital they'd get arrested. And so then the hospital, in protest, all the employees, rightfully so, refused to function until the doctor was freed. So you have like the only place where you could go that's probably got the capacity, one of the few places, the capacity to treat serious injury and or COVID. I think they're designated as one of the COVID hospitals. They just kind of shut down. The government hospital, the hospital of the general hospital of Haiti, the doctors and nurses have been on strike for months.
Yeah, sure.
It's not even open. There are people giving birth on the floor in the hallway, if they even show up, because what's the point? So, and then you have amazing healthcare options in Haiti, most notably, of course, Partners in Health Hospital at Mirbalais, and St. Boniface Hospital, which is now called Health Equity International, I believe. But they are in like opposite parts of the country, hours from Port-au-Prince, so you just have all sorts of barriers, to get to even just the transportation to get there kind of thing. And the roads are not secure, so people aren't traveling as much as they were. You have random enforcement of these, gathering laws. So, a tap, which is the public transportation, a pickup truck, basically with benches built in the back of it, would normally have like, 12, 14 or more people in it. Now they're supposed to only have like 2 or 4. So of course the drivers aren't making enough money to warrant making their trip, so there's just layer upon layer upon layer upon layer. And yeah, I don't know that we're going to see a huge international relief effort for Haiti, because everybody's dealing with their own thing.
Yeah.
So I'm worried about it, for sure worried about it. capacity to respond to it. But also, I think we're, and it's not unusual in a place like Haiti for people just kind of die at home.
Right.
they can't seek treatment, and or if they do seek treatment, they will seek, the more traditional, you know, remedies. The same employee who I was speaking to this morning talking about social distancing said, "Oh, everybody's drinking this tea. It's fine." like, oh, well,
Yeah.
who am I to judge? I'm not Haitian,
Probably
and
equally as efficacious as what we have right now, which is really nothing. All
right.
the yeah. Uh,
Well, it's funny. I look back and I see all these things, references and comparisons to the Spanish flu in 1918, I think, and the strategies to avoid getting sick in 1918 seem terribly similar to the ones in 2020.
Yeah.
Put a mask on and don't go in groups. And it's like you would think that the most powerful country in the world with the best healthcare would have come up with some better strategies than that by now. But
You would think so, but we actually, I think, just today topped Italy in the number of deaths worldwide. So we lead. Yeah, we're a leader in the number of cases, and now we've also won a gold medal for the number of deaths as well. And, yes, I think it's a really good kind of marker of just what our healthcare system is like. My only hope is that there can be maybe some good that comes from this when we realize that we can restructure the healthcare system here in the United States to better serve the entire nation. But that's a long ways off. We still have to get through that. But yeah, so yeah, I mean, the tea might not be a bad idea. In fact, maybe they should. There's someone, again, a gentleman who's got some magical thinking that they could talk to, that he might start pitching that as well. I'm sure he'd even maybe buy some stock in the company.
They're not so keen on him, I don't think.
Yeah.
But it's not funny, but it's just another symptom of the situation that the country is in, and you have, at least they are taking steps. I mean, just recently there was a Haitian pastor, self-proclaimed pastor. I'm sure not somebody who's been through like divinity or school or anything, but. There was a rumor going around on this WhatsApp chat. A lot of expats are on this like security chat, and you get all these random updates of things that are happening. And this one pastor had called for the cure to COVID was to go through your Bible page by page, literally, like legit. This is what he said: just page through your Bible, page by page, and if you found a human hair in any of the pages, to take that hair and make a tea out of it and drink it, and that would be your
that
cure.
would be the cure. Okay, well, I'm gonna have to locate my Bible. I'm sure it's on my shelf somewhere.
Mine's dusty, I think.
I mean, these are the things though that that's very traditional for lots of cultures to have these ideas on that, and unfortunately, it can be really detrimental when there may be a time where there's something that can be done, or there's a medication that might be beneficial. I know that sometimes people's, ideas around medication is that in itself is bringing harm. And so, that's another potential for some major issues. If we do say, oh, ivermectin, which there's actually a lot of in Haiti. I think we used to give it to the kids like once a week. That's a medication that might actually have some benefit. If it's found to be useful against the coronavirus. One, will people start taking it from Haiti? Will it be something that becomes a black market drug that Haitians will then have limited access to, or will people be worried about taking it and cautious and denounce it? And so that another kind of issue that. It's not just Haitian culture. There are many cultures that.
No, not at all.
But certainly
and it's
accentuated there. Yeah.
Sure. Yeah. Well, and there's also something to be said, and again, as a non-medical, as you said, I've got, I dabble, but I'm not officially formally trained or anything, but, there's something to be said for placebo effect, apparently. I mean, I have lots of, again, I'm the only American, the only non-Haitian, I should say, in my town where I work and live, of 30,000 people. And so I almost invariably, it's my gate that gets knocked on when there's a situation that, somebody needs to be helped, connected to something better than the local hospital can do. Or,
Right.
but I have seen people swear by these traditional, remedies, and I have even taken some. My one of my employees, she's like this, like mother, like, and she's, if I have a cough, she brings me this horrible, tasting thing, and it, whatever. But I have seen people swear by it, and I've seen people, other things just kind of pass, So when your traditional remedy works, it just reinforces that, particular belief. And when your traditional medicine sometimes doesn't work, then it just builds and builds and builds. And it's always interesting. And I just hope that we can kind of come somewhere in the middle and say, okay, here's some things that we know are going to help slow this down. Continue doing what you need to do and what you think is effective, but here's some other suggestions. And we're starting to see people are, we're starting to see, I spoke to my one of my employees yesterday, and she was saying, schools are closed, everything's shut down, but people are still, the streets are still normal. Nobody's wearing masks. Nobody's, blah blah blah. And the government has said, if you're in public, you have to wear a mask. Well, that's a nice thing to say if you don't have the money to get one.
Right.
So my organization, we just bought 500 masks, which I know is a small number, but we bought them so that we can give them out to our students and their families. And we're starting to try to set an example or lead by example in some of these ways. And we are doing we're doing like food distribution to 200 and some families this week. Hopefully keeping them from the need to congregate in the markets to go out and buy stuff. So we're delivering things to them. And there's a lot of organizations who are making efforts, but it's just such an overwhelming problem. Obviously,
right.
It's overwhelming without COVID. And
right. No, absolutely. And that makes me think too about kind of the impact of that community healthcare worker or someone from the community or village or what have you, being that person who leads those kind of efforts. What's your thought on that? It's easy to come in as a white American and say, you need to social distance and wear masks. But it seems time and time again, anytime any of these things have been successful, it's because the community itself has made it happen. Do you feel that there's a possibility that could have an impact, or is there a structure set up for that kind of thing to happen there?
Yeah, I mean, again, I can only speak to my area because I'm not there right now, but I haven't nationwide, I'm not sure, but I know that in the area of Gomoran, Funkose, which is a credit union, basically, they have a huge network of community health workers, and I know that they have gone out and our organization and other organizations have supported the local government, the mayor's office in our town, to go out and to build these hand washing stations and go out into the communities with just instructions on what's happening and what we should be doing and not doing in terms of trying to avoid it. So there is an element. There are community health workers through Funkose, especially. They're going out on motorcycles into these rural areas. They walk around with megaphones and are sort of saying, here's what we should do and what we shouldn't do. And so hopefully there's going to be an impact with that. But again, there are so many other factors that it's hard. We just saw last week in Port-au-Prince in Pétionville, which is kind of the wealthier suburb of Port-au-Prince. There was a protest because the police had arrested a Haitian guy who was saying that this was all made up, publicly telling people, to disobey the orders of the government. And so they arrested the guy, and then this huge protest formed in front of the police station to demand for him to be freed. And so on one hand, this guy was saying, this is made up, it's not true, it's another effort to manipulate the people and make money off the backs of the poor in the international community or whatever. And so they were protesting this, the arrest of the guy who was speaking truth to power. And then in the next phase of their protests, they tore down all of the hand washing stations in the area, which are 5-gallon buckets with soap and a spigot built into the, they're pretty simple. But they took them all and they put them in a pile in front of the police station and they burned them all. So it's like, okay, well, if you don't believe that it's there,
Right.
Why are you burning down the hand washing station?
Yeah.
And the reason was the buckets are from China, and
Okay.
so there's
Yeah.
just
Yeah.
so much misinformation and so much distrust, and it's just none of it makes any sense, really.
Yeah. Yeah.
Um, it just so it's going to be a long fight for Haiti and for all of us, it seems like. But
Seems like it.
and
Yeah.
maybe maybe there'll be some kind of miracle and it'll pass Haiti, and who knows? But
Maybe prestige is the actual cure.
prestige,
Yeah.
I
Yeah.
think prestige can kill a few things.
It
Yeah,
can
if
kill a
not,
few
then
things for sure. Yeah. Yeah. For those of you
if
who don't
not,
know,
well,
that's a beer from Haiti, and it certainly has some antiseptic properties. That's for sure. Yeah.
yeah, if not that, we'll get some Clarin, some of the moonshine.
That's right. That's right. Well,
I'm diabetic,
Jonathan,
I use hand sanitizer. So.
exactly. Yeah.
Yeah.
I want to say thanks for joining me today. It's been great to have a conversation with you as always. We'll obviously
Yeah.
keep in touch. Thank you for illuminating this to our audience, and please stay safe, stay healthy, and I look forward to talking to you again soon. It's been a pleasure chatting with you today.
Yeah. All right. Thank you, Thank you, Steve.
Hey,
Take care.
have a good one.
And thanks
See
for
ya.
your valiant fights in the ER there. My God.
Oh, hey.
It's got to be.
Well, it's
You'll
fueled
be
by
ready for a
pizza right now.
What's that?
It's fueled by pizza. Everyone sends pizza to us, pizza and pasta, to thank you for our efforts. I didn't think morbid
Yeah.
obesity was going to be one of the side effects of this pandemic, but I'm putting some pounds
Yeah.
on. But I'm not going to complain. It's been.
I'll send you a case
great.
of Prestige.
There you go. All right. Have a good one.
Take care, my friend. All
See
right.
ya.
Thanks.
Bye.
Bye.